Have you been waking up every morning with a dry mouth, a sticky tongue, or feeling like you desperately need water the second you open your eyes? Most people think it's harmless. They blame the weather, sleeping with a fan on, or simply getting older. But what if your body is actually trying to warn you about something much bigger? Because according to health experts, persistent dry mouth at night can sometimes be linked to dehydration, mouth breathing, poor sleep quality, medication side effects, blood sugar issues, or even sleep apnea, a condition many people don't realize they have. And here's the scary part. Many people ignore this symptom for months, even years, while the real problem quietly gets worse in the background. Dry mouth doesn't just affect your comfort. It can damage your teeth, irritate your gums, affect your digestion, ruin your sleep, and leave you exhausted during the day. Some people even notice headaches, brain fog, bad breath, or waking up multiple times during the night without understanding why. But today, you're going to discover the hidden causes behind waking up with dry mouth, the dangerous warning signs you should never ignore, which everyday habits may secretly be making it worse, and simple things you can start doing tonight to help your body recover naturally. And if you're over 50 or 60, this video could be especially important for you, because as we age, our body produces less saliva, we take more medications, and our risk for sleep and hydration problems increases dramatically. So before you brush this off as normal aging, stay with me until the end. One small symptom in your mouth could reveal a much bigger health issue happening inside your body right now. I need you to hear what happened to Margaret, because Margaret's story is the reason I am making this video right now. Type your age in the comments and whether you wake up with dry mouth, yes or no. You'll be stunned. How many people watching right now have never once mentioned this to their doctor? Margaret was 71, a retired school teacher from outside Columbus, Ohio, the kind of woman who spent 34 years caring for everyone else and never once wanted to be a burden. So when she started waking up every morning with a mouth so dry she kept water on her nightstand just to speak, she said nothing to anyone. She figured it was aging. She figured it was normal. For 18 months, Margaret woke up like that every single day, and during those 18 months, her body was screaming in the only language it had left. She lost weight without trying. Just a pound here, 2 pounds there, until her daughter noticed her clothes were hanging wrong. She had trouble swallowing dry foods. She got a chest infection in spring, another in fall, another the following winter. Each time antibiotics, each time sent home, and each time nobody asked the question that should have been asked. Why does this woman keep getting chest infections? Then came the third hospitalization. Margaret woke up one Tuesday morning, unable to breathe, lips slightly blue, her daughter calling 911 with shaking hands. Her oxygen saturation had dropped to 81%. Healthy adults sit at 95% or above. The diagnosis from the pulmonologist stopped her daughter cold, aspiration pneumonia severe, developing not over days, over months. Here's what that means and why it matters to you directly. Every night while Margaret slept, bacteria from her dry, unprotected mouth were being microscopically inhaled into her lungs. This is called microaspiration. It happens to everyone during sleep, but in a healthy mouth, saliva neutralizes those bacteria before they can travel anywhere. Saliva contains immunoglobulin, lysosome, lactoin, your mouth's immune checkpoint. Margaret's mouth was dry. That checkpoint had been dismantled, and for 18 months, bacteria had been making their way into her lungs every single night while she slept peacefully, completely unaware. 19 days in the ICU, intubated, permanent lung damage. Before we continue, take a quick moment and ask yourself this. Do you only wake up with a dry mouth once in a while? Or is it happening almost every single morning? Because your answer matters more than you think. Occasional dryness can happen after salty foods, dehydration, or sleeping with your mouth open. But when dry mouth becomes frequent, your body may be struggling to maintain proper hydration, healthy breathing during sleep, or balanced saliva production. And saliva is far more important than most people realize. It protects your teeth from decay, helps control bacteria, supports digestion, and even keeps your throat and airways comfortable while you sleep. When your mouth stays dry night after night, harmful bacteria can grow faster, increasing the risk of gum disease, bad breath, mouth infections, and even difficulty swallowing. But here's something even more surprising. Many people suffering from dry mouth are unknowingly making the problem worse every evening. Things like alcohol before bed, too much caffeine, sleeping with a fan blowing directly on your face, certain medications, smoking, or even using the wrong toothpaste can all contribute to severe overnight dryness. And for some people, dry mouth is actually a hidden clue that they are snoring heavily or experiencing interrupted breathing during sleep without realizing it. That's why paying attention to this symptom early is so important. In the next part of this video, I'm going to show you the biggest warning signs that your dry mouth could be linked to a more serious issue, and the simple nightly habits that may help you wake up feeling refreshed, hydrated, and healthier again. You do not want to miss this next section. When seniors take 3 or more of these simultaneously, research from the Journal of the American Dental Association in 2023 found the suppression effect doesn't add up. It multiplies 3 xerogenic medications don't cause 3 times the dryness. They may cause 6, 7, or 8 times the salivary gland suppression. This is called compounding xerogenic effect, and almost no one discusses it during prescription reviews. Third, dry mouth causes malnutrition even when you're eating normally, and this one surprises every patient I tell it to. Saliva triggers your entire digestive process. It contains amylase to begin breaking down carbohydrates and sends chemical signals to your stomach to prepare acid for digestion. Without saliva, that signal goes quiet. Nutrients pass through without being properly absorbed. A 2022 Mayo Clinic study found that 44% of seniors diagnosed with unexplained malnutrition had clinically significant dry mouth that had never been identified as a factor. You can eat 3 meals a day and still be slowly starving. Fourth, a dry mouth is an open door for bacteria to reach your heart, brain, and bloodstream. Your mouth hosts 700 species of bacteria and a carefully balanced ecosystem regulated by saliva. When saliva disappears, the dangerous ones, Strep mutans, Pyophramomas, gingivalis, Fusobacterium nucleotum, surge within weeks. And according to research in Nature Reviews Microbiology in 2023, they do not stay in the mouth. They enter the bloodstream through microscopic gum tissue breaks and have been directly linked to heart valve infections, worsening diabetes, accelerated cognitive decline, and sepsis in vulnerable seniors. Fifth, dry mouth is almost never just one thing. It is your body's way of flagging something deeper that hasn't been diagnosed yet. And that brings me to the 7 warning signals I promised you. Pay close attention to this section because this is where most doctors completely drop the ball. Before I give you the list, I want to ask, how many medications are you currently taking? Just type the number in the comments because the second story I'm about to tell you is critical. If that number is 3 or higher, Robert was 68, a retired firefighter from Atlanta, 31 years walking into burning buildings. So when dry mouth woke him every morning, he did what tough men do. He ignored it. 2 years passed. Then the tooth pain started. When his dentist, Dr. Simmons, looked inside his mouth, she paused before speaking. 8 teeth destroyed by aggressive decay in 14 months. She had only seen numbers like that in radiation patients. She started asking questions. Discovered Robert's acid reflux medication combined with his blood pressure diuretic had chemically stripped his mouth of protective moisture for 2 solid years. But the teeth weren't the worst part. Dr. Simmons took a bacterial culture. What came back made her reach for the phone immediately. Robert's oral Streptococcus mutans levels were among the highest she had seen outside a hospital. A 2023 Johns Hopkins study of 8,400 men aged 65 to 75 found elevated oral Streptococcus mutans was associated with a 34% increased risk of a major cardiac event within 18 months. Robert's cardiologist found early arterial inflammation. Medications were adjusted, dry mouth treated. Robert is fine today, but he was 6 months from a potential cardiac event. And a dentist asking the right question about dry mouth is the only reason he's still here. Now the 7 signals here, they are signal 1, ammonia breath with dry mouth. If your morning breath smells metallic or chemical rather than just stale, that is a potential kidney function warning. Request a kidney function panel. Signal to thick, ropey, or foamy saliva. This is not absence of saliva, but altered saliva. This is a SIN, autoimmune signal. Sjogren's syndrome, lupus, rheumatoid arthritis. Request autoimmune screening. Signal 3, dry mouth only at night. If daytime is fine, but mornings are severe, this is a direct sleep apnea pattern. Your airway is collapsing during sleep and forcing mouth breathing for hours. Get a sleep study. Signal 4, dry mouth plus frequent nighttime urination. This combination is a diabetes warning. High blood sugar pulls water from every tissue, including salivary glands, while driving up urinary output. Request a fasting glucose and HbA1c test immediately. Signal 5, dry mouth plus dry, gritty eyes. This is the hallmark of Sjogren's syndrome, affecting an estimated 1 in 70 women over 60 and dramatically underdiagnosed. And is treatable, but can progress to the kidneys, lungs, and nervous system if missed. Signal 6, dry mouth plus leg or foot cramps. This combination flags a serious electrolyte imbalance. Low sodium, potassium, or magnesium, especially dangerous if you take diuretics. An electrolyte crisis combined with dry mouth can trigger cardiac arrhythmia. Call your doctor this week. Signal 7, dry mouth that started within 90 days of a new medication. This is your body telling you it needs a polypharm pharmacy review. The 90-day window is when anticholinergic suppression reaches its clinical threshold. Do not wait for your next appointment. Now, what to do about it? 7 steps straight from my own practice protocol. Step 1 is the morning mouth assessment. Before you drink anything, take 60 seconds. Is saliva present? Is it thin or thick? Any chemical smell? Can you swallow without water? Do this daily and you have the data your doctor needs. Step 2 is the medication audit. Write down every medication prescription and over the counter and check each one for the words anticholinergic or xerogenic. Step 4 is the nighttime protection plan. Ellie, vape the head of your bed 4 to 6 and using bed risers, not extra pillows. Run a cool mist humidifier at 40 to 60% humidity. Use a xylitol-based dry mouth rinse, never alcohol. Based immediately before sleep. Step 5 is saliva stimulation. Xylitol gum after meals. Sour sugar-free candy to activate the parotid glands. Crunchy raw vegetables with every meal. These are clinically supported, simple, and free. Step 6 is your doctor conversation script. Say this exactly: I've been experiencing chronic xerostoria affecting my sleep, nutrition, and swallowing. I'd like to discuss whether my medications are contributing and request the salivary gland function assessment. Clinical language gets clinical results. Step 7 is the emergency red flag list. Dry mouth with difficulty breathing. Emergency room now. White patches in your mouth. Call your doctor today. This is oral candidiasis. Dry mouth with sudden confusion or weakness. Call 911. Dry mouth with chest pain or rapid heartbeat. Call 911. Dry mouth with unexplained fever. Same day urgent care. Let me quickly address what I know you're thinking. Your doctor said it's just aging. Is that true? No. Clinically significant xerostoa is almost always caused by a medication, a medical condition, or both. It's just aging is a dismissal, not a diagnosis. You have every right to push past it. Now you can see why waking up with a dry mouth should never be ignored. What seems like a small morning annoyance could actually be your body's way of signaling dehydration, poor sleep quality, mouth breathing, medication side effects, or even deeper health concerns that deserve attention. The good news is this: in many cases, simple changes can make a huge difference. Drinking enough water during the day, improving nighttime breathing, reducing alcohol and caffeine before bed, checking your medications with your doctor, and creating healthier sleep habits may help your body recover naturally. But the most important step is awareness. Your body often whispers before it screams. And symptoms like dry mouth are sometimes early warning signs that something inside your body needs care and attention. So please don't just cover up the symptom with a sip of water and forget about it. Pay attention to what your body is trying to tell you. And if your dry mouth is happening frequently, especially along with snoring, fatigue, headaches, bad breath, or excessive thirst, it may be time to speak with a healthcare professional and get to the root cause. If you found this video helpful, make sure to subscribe and turn on notifications because we share simple, powerful health information designed especially for adults over 50 and 60 who want to stay healthy, active, and independent for years to come. And now I'd love to hear from you. Have you ever experienced dry mouth at night? What helped you the most? Leave your experience in the comments below. Your story might help someone else watching today. Take care of your body, stay healthy, and I'll see you in the next video.